So for us, whether it's us as the physicians or you as a patient, we oftentimes have some very common goals, and the common goals usually run pretty consistent, regardless of what location we're going to, which office we're at, the age of the patient. But it's this: we all want to avoid surgery, right? We're all sort of a little bit leery about what it means to have an operation happen, when those things happen, the permanence of that. Number two, we want to stop medications, the dependence on medications and reaching for the medications every time we experience pain. It's not how we want to live our life. And last, whatever solution we have, we want it to have something that improves our quality of life. Oftentimes when we're living in pain, the quality of life is what suffers, and we want that returned. And in order to ensure that, in order to make that happen, a couple of things are also going to be important. We want a plan. We don't want this sort of last minute thought or hearing from a physician that doesn't have this arcing plan about, all right, here's going to be step one and step two. We do want that. But on top of that, we all want it to be safe. We don't want extreme measures. We want something with low risk. We want short recoveries. We want to avoid the pitfalls. And I don't think that asking for these things means that you're asking for impossible things, but I think it is our nature to ask for these sorts of things, because obviously we want to drive them the least amount of impact into our life, into the quality of our lives. So let's go through a couple examples here. The first example here is of a retired psychologist who flies airplanes for a hobby, is also a runner, competitive, and runs also for stress relief. But the back pain ended his running. No more competition, fun, stress relief, all of that stopped. This also significantly limited his flying time. The second example is of someone a little bit younger who's a chef, enjoys spending time with his family, has young children, but is in constant motion, right? You're in a busy restaurant, moving heavy equipment. This was affecting his work, made it difficult to get through the workday. Even contemplated changing careers, and we understand the different levels of impact of back pain. It can be as significant as yeah, maybe it just ended running, or it might be career ending. But traditional medicine was really missing the target, and traditional medicine meant surgery, which was not ideal by any means. We know that it's permanent, we know that it's invasive, and we know that the recoveries can be long. Next is the medications. Steroids, we know, are a band-aid. They don't solve anything. They weaken and often damage tissue, and then therefore repeating the steroids just means repeat weakening and repeat damage to the tissue. So not great solution there. And OTC stands for over-the-counter, and we know over-the-counter medications can help lessen the symptoms, but the effects wear off, which means you have to repeat the dose, oftentimes kind of like steroids. 2 months after our patients had their stem cell therapy, the psychologist was back to running, ran the 4th of July 4-mile race here in our local town. He was doing a 13-minute pace, wasn't his speed of choice, but was happy that he was able to run it. Enough so that he's now started to run and train for a half marathon with his grandson. So I'd probably say that's a pretty good success there. The chef was able to return to work full-time, able to provide for his family, and actually both patients have gone on to be pretty good proponents for us and what we do. So how exactly is it that we do what we do? What exactly is the secret? And the secret is that you've got to break this cycle. And this cycle, even though we maybe all live it, maybe don't necessarily know it. And the issue is that pain leads to degeneration, and degeneration leads to more pain, which then is just this progressive cycle where the letters are getting a little bit bigger, where the red is getting a little redder and the arrows are getting a little bit deeper. And this is the thing that we're really trying to end and move away from. And I can tell you that we are successful at doing so. How do we do it? Well, we are the third solution. So if you said the unsuccessful first of surgery and the second being medications, we're the third solution. And why we really feel like and feel so passionate and so strong about this is that our success rates are high. We're talking about therapies that last for years, not just weeks or months. And the third is guaranteed acceptance, meaning that there isn't foreign tissue. This isn't coming from a body, from somebody else. This is all you. So there is no chance of rejection. But what exactly is regenerative medicine? So regenerative medicine, it's a new field. The whole purpose here is to restore and not replace tissue. So surgeries often are about replacing things, cutting out knees, cutting out hips, drilling in screws, drilling in hardware, but that's not the goal here. It's really to turn damaged tissue into healthy and functional tissue. And this is obviously a different and new concept because we don't have things like this normally in medicine. The different materials here are used to restore this health, including platelets and stem cells. The three circles here are when to use PRP and when to use stem cells, PRP being platelets. So when you're in the small green circle or your problem is smaller or maybe even moderate at the yellow circle, you're talking about the use of PRP. But as the problems get bigger and you're into the red circle, we're really looking at stem cells. So severity of the problem matters. To give you an idea of what exactly happens when tissue is inflamed and damaged, red is bad and green is good. Here's a good example of infiltrating green good cells into the red bad space. The red is what drives your pain. It's what drives stiffness. It's what drives sciatica, nerve pain, neuropathy, the shooting, the aching, the grabbing. So a lot of this that you experience has a real reason for you. It's not just in your head. There's a real reason for you feeling these symptoms. And this is a good short clip of how these cells move from areas of health into damage. I like to use this example when talking about the difference between platelets and stem cells. And I know it's sort of a cute example, but bear with me here. If you can think about Pac-Man and Pac-Man problem, think about the pellets as the pieces of inflammation in your spine, in your knee, your hip, wherever it's damaged. The Pac-Man eating the pellets one at a time is the equivalent of, let's say, what platelet-rich plasma does. And so that's one Pac-Man. But imagine putting 1,000 Pac-Mans into here, eating all the pellets at all the same time. That's what stem cells do. The goal isn't to play any more Pac-Man. The goal is to beat the game, leave the problem behind, and not come back to it. And we're talking about 5 to 10 years of being able to step away from this game, if you will. So where exactly do the cells come from? So the spinning pelvis on the left, or my left, is where the cells are being extracted from. So on the back side of the pelvis there. Then these cells are then inserted into the clear blue spaces along the left side of that spine image. And you can see as the images flip back and forth between degenerative disc to healthy disc, that's the basic concept and idea. Can we take a degenerated disc and make it healthy so that it relieves tension off of the spinal cord, so that it relieves tension off of the nerves? All right, so this is what you want to do, and this is something you're interested in. What does the timeline and schedule look like for us? Well, the very first piece is to obtain a consultation with us, and so you call the office and create that consultation. Once it's decided, we have you go through the MRI. Then pretty quickly after that, we do the first injection, which is a platelet-rich plasma injection. And that is to help take care of some of the more minor issues that surround your knees, surround your hip, surround your spine. Then the second injection is the stem cell and yet more PRP. Here, the PRP has the action of adding to the power of the stem cells. So if you can imagine, the stem cells are good by themselves, and then the PRP added, it makes for an exponential effect. Then somewhere down the line, we do a third injection, which is the third PRP. And at that point in time, we're encouraging people to go to physical therapy, seek chiropractic care, start exercise routines and regimens, and help sort of rebuild the strength that you've lost over the weeks, the months, the years. And that's really what's going to help us keep you successful. So where can we apply this to? Whether it's in the higher in the neck or lower in the back, there's a lot of the same problems. And these issues can be stenosis, arthritis, degenerative disc, sciatica being in the lower back. What about some lower body pains? Absolutely, you can treat hip, knee arthritis, bursitis in multiple places, meniscus issues, Achilles tendon down in the ankle. What about the upper body problems? Sure. Rotator cuff, arthritis, tennis elbow, carpal tunnel. This isn't an extensive list, but is probably a pretty good example of some of the things that we see commonly. So now you're not sure, or you're still not sure. Okay, you're learning, but are you a candidate? The way I sort of like to explain this is that anywhere that can be injected or operated on is able to receive stem cell therapy, meaning if I can get a needle to that point, then it's able to obtain or able to receive that stem cell. So what's important in all of this is whether or not you've got the right diagnosis. So when you say back pain, that's not a diagnosis, that's a symptom. Do you actually have the right symptom to go along with the kind of therapy we'd like to offer you? So the accurate diagnosis is critical because that leads to the accurate therapy. And I can say this pretty confidently and pretty proudly, we are the only regenerative medicine provider with our own MRI. And I can't stress enough why or how that's important, that an MRI really will help drive where the therapies go. It's not always important for the diagnosis, but it's in that combination of both diagnosis and placement. We get this question a lot. What if I've had surgery? The answer is yes, but consult. So in that initial consultation, we'll go over the diagnosis, we'll go over your imaging, the history of the exam. Again, the type of surgery is going to be important, whether you've had arthroscopy, whether it's a fusion, whether it was a rotator cuff repair. We're going to need to know all of that. Common questions for us. Where will my stem cells come from? So in our office, 100% they come from you, they go back to you. Number two, how long before I can become active? So for us, by that third injection, by PRP number 3 that we talked about before, in that timeline, you're returning to activity. When do I feel the benefits? So the majority of our patients will feel the beginnings of the benefits within the first 4 weeks after injection number 2, therefore before injection number 3, and then it's just continued improvement over the next several weeks to months after that. How long will the tissue stay repaired? Again, our results quite oftentimes lasting 5 to 10 years. One of the questions we get often is, well, what happens after, say, 7 years? Am I able to have that therapy again? And the answer is absolutely yes. And the question of how well does this work? For the majority of our patients, you get majority relief. And if you compare it to surgery, compared to medications, you'll quickly know or quickly learn that this is quite different than a lot of the other options that you have out there. So let's get to the question and answers that people have submitted thus far, and then I'll get to questions that people in the webinar are asking. Number one, from Elvira K, who's from the 518 area code. I've lost feeling and control of my left foot due to a pinched nerve in my back at L4, L5. Had surgery to, quote, scrape down the bone to relieve the pressure. Hasn't helped. Anything you can do? Absolutely. So failure after surgery is something we see commonly. It isn't with all surgeries, but again, the type of surgery is important. This one would be a case that we're pretty familiar with and able to help and have helped people in similar conditions. And it's important to remember that pain is more than just pinch. It's not just compression of the nerve. It's about the inflammation that comes along with that compression and where that compression is and exactly how bad is the stenosis, obviously, which a more recent MRI, especially after surgery, can help answer. And the next question from Jorge from area code 315. I'd like to know about healing the herniated disc that pinches the sciatic nerve. So similar to the last question, but a herniation really is one of my favorite analogies is the jelly leaving the donut. And you can see I've sort of blown up here where the blue is the donut, and any sort of push back into that yellow is how that irritation occurs. Obviously, use of the stem cells is a biological repair. It's not a repair with hardware, with screws, with metal, with surgery. It's using the biology of your own body to repair that disc and then therefore take the pressure off of that nerve, take the pressure off of those symptoms running down your leg, take the pressure off of the numbness in your feet. Darlene from the 413 area code, can the same treatment be applied to hips and SI joints? Absolutely. There is, again, a wide range of applications. We've treated everything from people's cervical spine or necks, shoulders, elbows, virtually everything down to the toes. So yeah, there's a wide application. Rich S from the 315 area code asks, options are, he wants to understand the options available and understanding of those different than surgery and medications. Again, this is really the third solution. It's not surgery, it's not medication, it's not going to disfigure you, it's not going to create some process in you that can't be undone. It is utilizing the cells from your own body to really treat the damaged areas that have accumulated over time in your body. Kendra S from 518 asked, if my husband has already had 2 neck surgeries, fusions from 4 to 7, can he benefit from stem cells? Absolutely. So fusion, here this picture is a good example of fusion, and that's when plates and screws are used to connect 2 vertebrae, so two bony levels there. And you can see this is a pretty obnoxious looking surgery. You're drilling something straight into the center of the bone, and obviously that can have its own issues. But what that also leads to is something called adjacent segment disease. So here you have this fusion. But if you can think about the level above it and below it, because of the loss of flexibility at this one level, now the level above it and the level below it need to increase their flexibility, which is why a lot of times people who have fusions end up having future surgery in 2 years, 4 years, 5 years, and then they have surgery, and then a couple of years later, they have yet more surgery. And that's what adjacent segment disease is. And that is one of the shortcomings of fusion. So Jill M from 518 asked about the extreme pain in her hands. Would this procedure help with hands? Yep. Thumb, wrist, finger, all things that we've treated with great success in the past. Small joints oftentimes have very few options, right? So therapy, steroids, but there isn't really a replacement surgery like you do with your knees. And so that conversation really runs dry pretty quick. And for us, a lot of our patients are seeing results in 4 weeks. And so that's always a big plus as well. Other areas, ankles, elbows, where things like replacements are a little bit less understood and a little less common. Warren from 518 asked, what exactly is stem cell therapy? How does it work? How long does it take to reduce pain? Does it work for the entire spine, lower as well as cervical? What about the other arthritic joints, and what are the costs? So going back to what I was saying before, again, anywhere we can place that needle is anywhere that can be amenable to therapy. Results in our patients are in as few weeks. We had a hip patient today who basically felt his hip relief about 4 days after his stem cell. So that, there's people who are in the days. The entire spine applies everywhere from the top of the neck, where the neck sort of connects to the skull, all the way on down to the side joints. All joints really do apply. Costs vary. It's hard to know. It's hard to say over internet or over a webinar. Really, that consultation needs to happen for us to know exactly how severe it is. Is PRP the better therapy for you? Is stem cell the better therapy for you? Matthew M from 518. Details about the procedure, again, cost, if Medicare would cover anything, all or some. Procedure is effective, if the procedure is effective for arthritic lumbar vertebrae, because they're having issues with the degraded and ruptured disc. Yes, very effective for L2, L3 arthritis, a pretty common diagnosis for what we see. For degraded and ruptured discs, that pain and degeneration is really how Matthews ended up at arthritis. What started off as pain and a rupture led to degeneration, and the cycle goes on until now you've developed arthritis. One of the unfortunate things, and this has unfortunately less to do with us, but our current healthcare model and our current healthcare system doesn't have room for these sorts of therapies for benefit and for coverage. So there really is no commercial or Medicare coverage at this point in time. Patty P from area code 518, she's got severe lumbar stenosis and bulging discs. Is this procedure still viable? Absolutely. So severity of stenosis and bulging discs are things that we treat quite successfully and quite often. The definition for stenosis, if you look at those two pictures here, and the picture in particular on the right, if you can imagine that blue sort of oval wrapped in the white lines around, that's the jelly donut, that's the disc. Stenosis would then be those yellow dots above, and that would be sort of the spinal cord looking out at you. As the disc degenerates, it's going to be pushing up into that space, creating that stenosis. So obviously treating the discs will help pull the pressure off of that stenosis. Again, going back to my jelly donut idea, bulging disc is the jelly trying to leave the donut, whereas the herniation is the jelly having already left the donut. Melissa AB from 315 asks, spinal stenosis, see if it can help. Again, stenosis, very common diagnosis. Again, it's a narrowing of that. That's what we call that central canal. There's stenosis of those side canals as well, where you see that big yellow sort of bulb coming out of that spinal cord. And again, you're now well aware of how degeneration of the disc leads to and impacts that stenosis. Faye from 802 area code says stenosis, in pain most of the time. Whether or not we can help you, absolutely. Degree of stenosis does not always correlate to the symptoms, so it's important to remember that. So for you, Faye, I would say, we really need to see you, talk to you, get an understanding of how bad this is exactly, and then do things like the MRI in our office to help us understand, well, you have this much pain, how bad is this stenosis? Does it correlate? Does it not? And even for us, the most severe of stenosis and most stubborn of stenosis have done well. So this is the other thing that we're trying to drive across too, that the MRI doesn't always necessarily convey what the patient is feeling, which is why that examination is pretty important for us. So getting you in front of us to be able to examine and understand this is important. David C. from 518 asks, does stem cell therapy work for herniated discs and sciatica pain? Diane M. from 902, and I believe that's up in Canada, asking about sciatica pain and lower back pain. Yep. So, we're sort of saying a lot of the same things here, but to say again, yeah, the herniated disc and sciatica usually travel together, because once that jelly has left that donut, that herniated disc is the source of the problem. And being able to go after that with the stem cells is what's key here. And getting these therapies to last, unlike surgeries, unlike medications, is important. For you, Diane, we could even offer you a virtual consultation to help start the conversation. And of course, we have the Plattsburgh office, which would just be a few minutes from the border. R. Wells from 518 saying, trying to reduce my pain level and increase my flexibility. How does regenerative medicine help? So for you, the pain, where's the pain coming from? And what is driving the pain? For you, getting that diagnosis right is going to be important. And so for us, the very next step is consultation. Let us examine you. Let us take a look at what the issue is, and let us get you into the MRI machine and help understand all the pieces of data that help me and help us decide the best course of treatment, the best course of action. And of course, the phone number there for you to call and make that appointment. Cynthia A. calling from or writing from 518 area code, how the techniques work with nerve pain and degeneration. So here's a little better picture of how nerves are affected. You could sort of see the jelly trying to leave that donut again. And as the jelly tries to leave the donut, it is pushing part of that donut into that yellow bulb there, or what we would call the axial nerve. So as that pushes in, you can sort of see a very close relationship, meaning that as the herniated disc heals, you can see how the pressure comes off of that nerve. Theodora F. from 518 asks, is cortisone shot a good first step to relieve inflammation, pain, and stiffness in the neck prior to stem cell or platelet therapy? So cortisone is temporary. There is a role for it. It's not a great role, but there is a role. The issue with cortisone being, of course, that when it wears off, then the effects wear off. We certainly advocate sometimes for a single injection. If your problem just might be solved with one injection, it's certainly worth trialing if you would like to head in that direction. But oftentimes, most patients, by the time they feel something, the cortisone is not often enough. Surgery is often what you'll be pushed towards next. Not by us, but by other offices, and that reaches a certain depth of tissue. but it also involves a lot of destruction. You've got to remove a lot of skin, fat, muscles in order to make that happen. Our therapy is different in that it's minimally invasive. Nothing's cut, nothing's moved. It's just the use of a needle as you would get, a vaccination shot or something along those lines. So it's that same sort of size and width of a needle. So we're able to get to the most level of depth with the least amount of damage, and I can't stress the importance of that relationship enough. Sig P from 518 asks back pain from sciatica and the L5 dislocation. So I'm using Sig's question here because this is a good explanation of the relationship about the health of a disc. So in my picture there, the intervertebral disc is at the top, and underneath that is what we call the cartilaginous layer, and then the bone underneath that. The flow of nutrients follows that red area. It goes from the bottom through to the top, or it can also come from the top down, but in this picture, it's drawn from bottom up. The issue with a degenerating disc is oftentimes that cartilaginous layer is destroyed, degenerated. The connection between the bone and the disc is lost. When that breakdown happens, the disc is left to fend for itself. And without a flow of nutrition, like anything else in our body, without a flow of nutrition, you're only going to degenerate and degenerate further. And going back to that pain and degeneration cycle early on, we know that the more that disc is left out there on its own, the more pain and circular degeneration happen. Maybe not overnight, but from year to year, from month to month, you can tell pains are happening more frequently. They're lasting longer. It's taking more to get over. Certain therapies aren't working like they used to. The ibuprofen isn't working. Tylenol doesn't touch it. Steroid injections are lasting a couple days. This is how you know. This is how you know that the disc is slowly but surely and progressively getting worse. Yeah, so that leads to your pain and stiffness. So David JK from 518 says, how does regenerative medicine help cure degenerated spinal disc? What are the risks? John Van A, also from 518, asks, can it be used for, what in addition to knees can it be used for? It's such a spinal disc regeneration. So the dry sponge is another good example or another good analogy for me. If you leave a dry sponge out, it hardens, it becomes inflexible, it doesn't want to flex, it doesn't want to bend. And that's basically what's happening to your disc, or in some cases inside your knee. And as that stiffens, it is progressively getting worse. You're getting inflammation now around it, causing pain. Stem cells is like taking what used to be wet, then became dry, and then now making it wet again. It is like taking that sponge and holding it under the faucet and letting hydration, letting fluid, letting nutrients flow back into it once more. And that's the critical difference between what we do and what any other therapy out there that's currently offered is different. Eileen R asks how long does this procedure last specifically for the knee? And so our process very easily lasting from 5 to 10 years, and I can say that pretty confidently. We've been doing stem cells for 10 years. We're the first regenerative medicine practice in the upstate area. We're the only dedicated regenerative medicine practice, meaning we don't do anything else. This is what we do. And each individual is, of course, different, but understanding the science and maximizing that therapy for you, the patient, is important, but that can really only be achieved through a consultation, getting an MRI, and getting as much information as possible. Roger M asked about, can you have a procedure done if you'd had a blood clot in your leg or your knees? in your leg on your knees. We would need your anticoagulation plan. So if you've had a blood clot, most likely somebody has you on anticoagulation. We are not surgery, so we don't present the same risk that surgery does. We have no hospitalization involved in what we do. Everything we do is right here in the office. Very, very different. But we would need to know what medication you're on and how long that's been going on and who's controlling that medication and so forth. But great question, and we can help certainly answer that. Kenneth M asks how it works to, from 413 asks how it works, to what extent, the time frame, whether they're adult stem cells, and cost of insurance. So again, our process lasting from 5 to 10 years, and with some patients going well beyond that. But there is individuality. So what matters to the success of your situation is going to be different than somebody else's, and you bring different factors to it. For us, it's your stem cells always, 100%, without a doubt, no question, no doubt. We only use cells that come from you. We don't get them from birth products. We don't get them from a vial. We don't get them from a freezer, a jar, nothing. It is 100% you every time. William W. from 518 asks about cartilage in his wrist and from psoriatic arthritis. Christine H. Asking from 315 about some more spine issues. So for William, psoriatic arthritis, yes, helped many people with rheumatologic conditions. Psoriatic arthritis, rheumatoid arthritis, host of other lupus. I'm trying to think of some other rheumatologic conditions, but we've helped many. And that's even if those pains are in the hand, the wrist, the knees, the spine. Not covered by private insurance, as I explained before. And for Christine H, yep, spine conditions are treated regularly in our office, very common for us, and again, not covered by private insurance. So Kimberly M asks a little different question here from area code 315. If this procedure is possible for her son's back injury that hasn't gotten better in a year, and due to his age, he's young, he's 22, they don't want him to have surgery. Totally understandable. Wondering on the cost and assuming workers' comp does not cover. No, thank you for the question, Kim. So back pain is not only for the old, right? So everybody gets back pain to different degrees. Recovery is different. But especially in the young, when they're dealt with chronic back pain, there are not a lot of great options. For us, we've treated degenerative disc back pain issues as young as 17. Again, consultation is key. We have an MRI, so we can help understand what exactly the issues are. But it isn't limited to 60 plus. We've treated young patients many times in the past. Mark asked from the 607 area code whether this was factual or a selling game. Is very much real. If you go to pubmed.gov, do me a favor and search degenerative disc and stem cell, and look at the number of studies that pop up. The content can be pretty language heavy in terms of some of the science and some of the issues that the terminology surrounding the space, but certainly worth looking at. Shannon B asked from 518 whether stem cells for nerve damage from spina bifida or a tethered cord can be helpful. And so these are what we are known as congenital conditions, problems that you're born with. I'd have to know a little more on this one. This one's going to take a little more information than your average back pain patient. So it's hard to be blanket statement about this. Consultation is going to be critical. MRI is going to be absolutely critical. So for anybody who's here at today's webinar, we're extending to you a free consultation. The deal is you have to call Friday by noon, and you have to mention webinars. You have to schedule that consultation. For those in the Montreal area, we will be doing an in-person seminar in January. Don't have the date yet, but here's some contact information for us: 518-871-9900 for a phone, richardkimmedicine.com, as many of you have already found, /webinars in order to get to future webinars, /MRI if you want to schedule your own MRI. Our next seminar date will be December 13th, again at 5 p.m. And so that's that. So let's see if we've got questions. Jim asks, how are the cells extracted? How long does the extraction process take? And how painful is this part of the procedure? Great questions. So the cells are extracted from, you saw my spinning model of the pelvis, from the backside of the pelvis. The extraction is done through what we call a bone marrow aspiration. And so for anybody who understands the bone marrow aspiration, how other people's have, other clinicians and physicians have done it and how we do it is very, very, very different. We use an extensive amount of lidocaine, numb the area incredibly well, and go in through what is basically the cortex of the bone into the next phase of bone, which is the marrow. We extract from that side. You are awake while we do it here in the office. We play music. We give you some gently sedating meds beforehand. And again, we numb it very, very well. To the point where I would say that this is not the complaint that, you know, when people have this done and have pain post-procedure, you know, it's recovery from injecting the disc or injecting the knee. But the extraction site is rarely a complaint spot. So thank you for asking for that, and it's something to be mindful of. Warren, thank you for asking questions. Warren writes, I have multiple issues, both upper and lower spine and arthritic joints. Where would you start? Ooh, this is a good one. This is a good one. So to understand where you would want to start, in some cases, in some people, you would think that you want to start from the most severely affected space. For example, if that was your ankle or your knee. But if your spine is involved, I almost always recommend starting from the spine. And I would say lower versus upper. And why I say that is because of core strength. If you can restore your core strength of your lower spine, you can more effectively recover from, say, for example, your neck or your knee. We all know that we've heard every physical therapist and every chiropractor and every personal trainer talk about the importance of core. It's true to me and what I do as well. If you have a strong core, your ability to build upon that, meaning into the neck or into the hips or into the SI joints, is much easier. So start there and build from there. I hope that answers your question. So I don't see any more questions coming through. And I'll give everybody just a second here. All right, it looks like all the questions are done. Thanks for attending today's webinar. Again, phone number here is 518-871-9900. Our website is richardkimmedicine.com. The next webinar will be December 13th, a Wednesday, again at 5 o'clock. Thanks for joining us.